millionaire, a billionaire, a trillionaire, a caring hand of a father, or even a loving palm of a mother.
Is that an exception?
Everyone could have it. No one has the power from stopping the spread of this virus.
Good day. My name is Nelvin Macaraeg, and I am from Abel 32, and I will be talking to you about the global pandemic we are facing 2 years from now. Coronavirus disease 2019, or known as the COVID-19, caused by the severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2, was initially detected in Wuhan, China's Hubei province's capital. December 2019 and has since spread around the world. On January 30, year of 2020, the World Health Organization, or known as the WHO, labeled the outbreak a public health emergency of international concern. And on March 11, 2020, it was recognized as a pandemic. On the second day of April, year of 2020, the number of patients diagnosed with COVID-19 globally surpassed 1 million. And on April 15, 2 million. And on April 27, year of 2020, 3 million. And on May 9, 2020, 4 million. 187 nations have been infected, with more than 4,148,346 cases worldwide.
COVID is real and it kills people. Please do your part to slow the spread of the coronavirus. Stay home, save lives.
Let's now talk about the variant of the coronavirus. First on the list, we have this Delta variant, or known as the B.1.617.2. It is a variant of SARS-CoV-2, or the virus that causes COVID-19. It was first detected in India in late 2020. The Delta variant was named on May 31, year of 2021, and had spread to over 179 countries by November 22, 2021. The World Health Organization indicated in June 2021 that the Delta variant was becoming the dominant strain globally. This variant is nearly twice as contagious as early variants and might cause more severe illness. The greatest risk of transmission is among unvaccinated people. People who are fully vaccinated can get vaccine breakthrough infections and spread the virus to others. However, it appears that vaccinated people spread COVID-19 for a shorter period than do unvaccinated people. While research suggests that COVID-19 vaccines are slightly less effective against the Delta variant, the Pfizer-BioNTech, Moderna, and Janssen, or known as the Johnson & Johnson COVID-19 vaccines, still appear to provide protection against severe COVID-19. Next, we have the Omicron variant, or known as the B.1.1.529. It is also the variant of SARS-CoV-2, or the virus that causes COVID-19. It was first reported to the World Health Organization from South Africa on November 24, year of 2021. This variant multiplies around 70 times faster than the Delta variant in the bronchi or lung airways, but evidence suggests it is less severe than previous strains, especially compared to the Delta variant. Omicron might be less able to penetrate deep lung tissues. Omicron infections are 91% less fatal than the Delta variant, with 51% less risk of hospitalization. We also have the Alpha, Gamma, and Beta variants that is continued to be monitored but are spreading at much lower levels in the US. And also, the Mu variant is being monitored. Did you know that our first COVID-19 survivor in Pangasinan is a 54-year-old nurse woman who got infected through local transmission after exposure to a doctor who was tested positive for coronavirus? And she got admitted in Baguio General Hospital on the day of 16 month of March, year of 2020. Ending up my report with the quotes, "Never in my whole life would I imagine that my hands would consume more alcohol than my mouth." Thank you and have a great day.
COVID-19 is rapidly increasing. Because of this, the WHO or World Health Organization encourage us to get vaccinated. The COVID-19 vaccines are safe and effective, providing the strong protections against serious illness and death. WHO or World Health Organization reports that unvaccinated people have at least 10 times higher risk of death for COVID-19 than someone has been vaccinated. There is also evidence that being vaccinated can help prevent you from spreading the virus to protect people around you. Some people question the COVID-19 vaccine. How do the COVID-19 vaccines work? Anyone who gets COVID-19 can become seriously ill or have a long-term effect. The COVID-19 vaccines are the best way to protect yourself and others. Here are some of the benefits of COVID-19 vaccines. First is reduce the risk of getting seriously ill or dying from COVID-19. Reduce your risk of catching and spreading COVID-19. Protect against COVID-19 variants. There are different types of COVID-19 vaccines. We have the Moderna vaccines, AstraZeneca vaccines, Pfizer vaccine, or Janssen vaccine. These vaccines are currently approved to use. The first dose should give you protections from 3 or 4 weeks after you have it, but you need the second dose for stronger and longer lasting protections. Some people are worried and have a doubt if the vaccines are safe. Are COVID-19 vaccines safe? Yes, COVID-19 vaccines were developed as rapidly as possible, but they all must go through rigorous testing in clinical trials to prove that they meet internationally agreed benchmark for safety and effectiveness. Only if they meet these standards can a vaccine receive validation from WHO and national regulatory agencies. UNICEF will procure and supply COVID-19 vaccines that meet WHO established safety and efficacy criteria and that have received the required regulatory approval. The COVID-19 vaccines approved for use in the UK have met strict standards of safety and quality and effectiveness. They can cause some effect or side effect, but not everyone gets them. Any side effects are usually mild and should not last longer than a week, such as a sore arms from injections, feeling tired, a headache, feeling or being sick. More serious effects such as allergic reactions or blood clotting are very rare. Vaccines save millions of lives each year. The development of safety and effective of COVID-19 vaccines is a huge step forward towards ending the pandemic and getting back to doing more of the things we enjoy with the people we love. It is important to be vaccinated as soon as it's your turn. Even if you have already COVID-19, vaccines offer more reliable protections than natural immunity. Getting vaccinated is a safer way for you to develop immunity from COVID-19 than getting infected. Even if you are already vaccinated, you still need to follow this. Wash your hands or sanitize yourself with alcohol, wear masks, and observe physical distancing. This is April Karen Solomon reporting.
Good day to all. I am John Daniel C. Laguardia. Now let's talk about the advantages of COVID vaccine. We all know that COVID vaccine have many advantages to us. First is we will be immune to COVID virus because we know that COVID vaccine is the number one cure for the COVID virus. And second advantage of it, we can travel where we want if we are fully vaccinated. Lalo na sa atin, as a student, we can go to school if we are fully vaccinated. And also, our immune system will be stronger if we are fully vaccinated. Alam naman natin, we all know that there are so many advantages of COVID vaccine para sa ating sarili. Sa lahat ng tao, di ba? And also, there are disadvantages of COVID vaccine, and that is will Heinah discuss to us. Heinah?
Hello, my name is Heinah Magnaan, and I'm here to talk about the benefits and advantages of vaccines. Vaccines are created to prevent the spread of a disease and helps our immune system fight off infection, thus giving us less of a risk of contracting the disease. Vaccines have been around for hundreds of years. Thanks to the ever-expanding of medical science, we have been able to prevent the spread of many diseases that once plagued nations worldwide. These diseases include polio, smallpox, and measles, just to name a few. At a young age, most of us have been given a vaccine to prevent us from catching these diseases. So far, it has been proven to work, seeing as there is very little to almost no cases of those illnesses being reported. Now I'm going to talk about the advantages of vaccines. Vaccines are the primary defense. Other than social distancing or wearing a face mask, being vaccinated is your primary defense in fighting off infection or viruses. Number 2, reducing the risk of infection. Given if you are vaccinated, you are less likely to be at risk of contracting the virus or disease and least likely to spread it. Number 3, helps with preventing the spread of the disease. Being vaccinated is not only beneficial for you, it is also a way of protecting the people around you. And number 4, helps your immune system fight off any future variants of illness. If enough people are vaccinated, that given population will be able to develop pathogens in their bodies that will help fight new variants of the disease. Overall, vaccines are important to maintain not only your health and well-being, but for all the people surrounding you. Hopefully, in the near future, we can all overcome this virus and prevent the spread of new variants of it. And hopefully, everything will go back to the way it was before.
Good day, it's 1 p.m. Friday, January 28, 2022, and here are some breaking news about the opening face-to-face classes in some towns in Pangasinan. Pangasinan State University Bayambang Campus prepares its resources for the limited face-to-face class setup for the upcoming semester. As the university prepares its resources for the limited face-to-face class setup for the upcoming semester, PSU Bayambang Campus conducted an opening house site visit in January 17, 2022. The activity was initiated by the Office of the Vice President for Administration and Linkages headed by Dr. Albert M. Galas. The concerned university officials led by Dr. Dexter R. Bured will be joining the opening house site visit to ensure that all aspects are prepared for the upcoming face-to-face classes. Meanwhile, here are some scenes about the first day of face-to-face classes look like in Alaminos City, Pangasinan. The first day of school at Longos Elementary School in Sitio Longos, Barangay Mangapisan on November 15 felt like a reunion of sorts. The pupils were first assembled at the school grounds where they were led to the hand-washing area, then through the triage for temperature check and taping of IDs in the digital logbook for their attendance before they were ushered to their classrooms. The 80 students were divided into two batches. The first 40 pupils will be physically present for a week while the remaining 40 will undergo modular learning classes. After a week, sila naman ang papasok sa school at modular learning yung mga naunang batch and so on, said Principal Fremalin Rabago as an interview over radio station DWIZ. Here are some updates about the Omicron variant in Pangasinan. Dagupan City, 4 confirmed cases of Omicron variant of coronavirus disease 2019 in the province of Pangasinan have been recovered, according to the Provincial Health Office or PHO. COVID-19 Omicron variant is still spreading around the world. That is why the public is always reminded to take care of yourself by following safety protocols. The Pangasinan Provincial Government received various medical equipment from the Department of Health Regional Office yesterday, January 5. This was after a meeting between DOH Regional Director Paula Paz Zaidianco and Governor Amado A. Espino III, where they discussed the preparation of the entire region for the threat of the Omicron variant. Governor Espino happily accepted the medical equipment from the DOH Center of the Health Development or CDH, which he said was a very important addition to the equipment of government hospitals during the pandemic. These include 2 units of ECG machine with analyzer and trolley, 1 unit of hemoglobinometer, 5 units of HEPA filter, and boxes of assorted multivitamins. The meeting included Assistant Regional Director Marwin Di Bello, DOH Pangasinan Provincial Health Team Leader Veronica Di Guzman, Provincial Administration Nimrod S. Camba, and Provincial Health Officer Di Guzman.
COVID-19 is still rising in Pangasinan. As per updated data of January 19, 2022, with the monitoring report, there are around 461 confirmed cases around the province. While there are 2,039 active cases, the death toll in the province as of today is 5 people. Despite an increase in the cases, the number of infected people who recovered has also increased. 35,365 is the total number of recoveries, out of 38,659 total cases. In the total cases of death toll is 1,255. On the other hand, vaccinated people in Pangasinan are doing well. Governor Amado Pogi Espino III posted the total number of vaccinated people in the whole province of Pangasinan. As you can see on the table, fully vaccinated people are 39% of the equivalent of 1.6 million people, while unvaccinated people are only 13% of the equivalent of 556,000 people. In addition, 46% of people have already received their first dose, which means a total of 1.9 million people. And those who already have their booster shots are only 2% of a total of 100,000 people. Based on PHO Chief Dr. De Guzman, Pangasinan is not at a critical level. In the question hour of Sangguniang Panlalawigan at Monday, January 17, Provincial Health Officer Ana Maria Teresa de Guzman assures this. Dr. de Guzman also claims that there are enough vaccines to cover 90% of the province population, including the pediatric age group of 5 to 11 years old in February. Hence of being vaccinated, authorities always reminded people to wear their mask, bring alcohol, and always observe physical distancing. Vaccination is definitely safe, so if there's a chance to get vaccinated, do it to prevent disease. This is Ruben Tamondong reporting.